Appreciate your testimony, and I look forward to our discussion today, sir. I now recognize the subcommittee ranking member, the other half of the Diana caucus, Representative DeGette, for 5 minutes for an opening statement.
Thank you, Madam Chair. I'll bet you this is the first time in history that both the chair and the ranker have been named Diana. On a serious note, Madam Chair, it's been a profoundly disturbing 15 months for public health and a profoundly disappointing 15 months for this Congress and for this committee. Measles is resurgent in the United States, and we're on track to have the most measles cases since just after CDC started recommending the 2-dose immunization regime, which was over 30 years ago. Researchers have seen promising work canceled, and young researchers are less likely than ever to be able to get the funding they need to launch exciting projects in their careers. And some of the most promising biotechnology companies are wondering whether the United States is where it should grow in their businesses as the FDA becomes less and less reliable and more politicized. I think the Secretary and I do agree on some things that are self-evident but yet are not being adequately addressed. We spend by far the most on healthcare in the rich world, yes, yet we have by far the worst health consequences. We have a chronic disease crisis driven by environmental contaminants and poor nutrition, among other factors. So, I'm mystified why tackling these issues has taken a back seat to peddling lies about vaccines, slashing vital public health programs, and seeding unfounded fear about Tylenol. I measure priorities in staffing, attention, and action. And where I have seen action, I have seen it taken in the wrong way. Secretary Kennedy fired the expert scientists on the Advisory Committee on Immunization Practices, replacing them with ideologues. Secretary Kennedy canceled research and development relating to mRNA technology, potentially setting back promising cures by years. And Secretary Kennedy directed the addition of safety warnings on Tylenol use in pregnancy, even though the evidence suggests that Tylenol is safe, while fever in pregnancy, which Tylenol treats, can be profoundly damaging. Madam Chair, I want to tell you 2 stories from across the country about the direct impacts from the last year. First, ending the HIV epidemic was a priority of the first Trump administration, but under Secretary Kennedy's leadership, locally driven programs to get effective medications to prevent HIV to at-risk individuals are in doubt. I was told of a project to increase access to long-acting HIV prevention medication for at-risk men in high-incidence areas that has been unable to continue because of funding terminations, restrictions, and instability. That means only one thing: more HIV infections in the long run. In Colorado, this administration's systemic refusal to execute the laws Congress's mandate for the Agency for Healthcare Research and Quality led to disruptions of clinical trials and wasted research time and money. A trial on pediatric medication therapy management, which tested using different medications to treat children with complex medical conditions, was forced to halt enrollment and go on hold. Now, the funding did just come through, but unacceptably late and suspiciously close to this hearing today. The damage is done. The trial had to temporarily close, leading to primary outcome data being lost and diminished access to cutting-edge care. That has a short-term and a long-term harm. Kids who could have benefited from the trial did not, and since the data was lost, it will be longer before any beneficial findings from the trial get integrated into practice more broadly. These stories represent a failure of leadership and a failure of vision. If we want to truly make America healthy, we need to follow the evidence, empower the scientists, and we need to be willing to change when we're wrong. Public health fails when we make decisions based on ideology. We are seeing the very failures of that kind of decision-making before our very eyes. This HHS does not have the confidence of scientists, doctors, or the American people. The Secretary of Health and Human Services must be a force for improving public health, not for dismantling it. The Secretary and this committee must ask a hard question. What is the legacy this HHS and this HHS secretary are leaving. We're rapidly losing our position as the gold standard in the world for medicine and for science. For the sake of ourselves, our children, and future generations, we must stop the bleeding and we must start to rebuild. I yield back.